in the audience is a bit depressing.
Okay, so okay, so maybe we can just start.
Yeah, yeah, the attendees are joining.
Okay.
We have about 10 already who's joined, more adding. Okay, over to you,
Okay.
Catherine.
Perfect.
Great, thank you. Okay, so good afternoon, good morning, everyone, and welcome to the side event for the APREMC-II on sharing best practices and way forward to achieve the overall 2030 target with an inclusive approach to education. So my name is Catherine Wilczek. I work in the Inclusive Quality Education team at UNESCO Bangkok office. So today's event is co-organized by the Disability Inclusive Education in Asia Pacific Working Group, so consisting of UNESCO, UNICEF, and Leonard Cheshire as co-chairs. And this event brings together a panel of speakers that are working towards the achievement of SDG 4 to ensure inclusive, equitable, quality education for all. The session will include discussions on the research findings related to inclusive education and ensuring safe and inclusive return to school for children with disabilities post-COVID-19. So thank you again for joining us today. Please let me go through the housekeeping information very briefly. In today's agenda, we will begin with some welcoming remarks from UNICEF, East Asia and Pacific Regional Office, and then followed by the panel presentation and discussions. So we have 4 speakers with us today to share 4 different topics related to disability inclusive education. Firstly, we will have Cambodia's experiences on inclusive education during the pandemic. Then we'll have a presentation on the multiple indicator cluster surveys, and then comprehensive sexuality education, professional development for teachers of learners with disabilities. And then we have, last but not least, the Korea's experience on the disability inclusive education policies. So after the panel discussions, we will have around 20 minutes to do the Q&A before the closing remarks by Leonard Cheshire. So next slide, please. So please make sure that you're signed in with your name and country so that we know who you are. And this webinar is being recorded. Any questions that you have for our panelists, please feel free to type into the Q&A box at the bottom of your screen. And we'll do our best to include all your questions into our discussions. But please be clear and concise so that we can direct the questions to the speakers. In terms of accessibilities, we have sign language available throughout this event, and also we have live captioning as well. You can click on the closed captions to read the captions of the discussions. And also at the end of the event, you will be redirected to the exit survey. So we would appreciate if you could help to complete the survey of this side event as well. Next, please. So finally, we will be uploading all the resources of this side event into the UNESCO Bangkok website, including the speakers' bios and the presentations, as well as this recording. So without further ado, let me introduce our first speaker, one of the co-chairs of the Disability Inclusive Education in Asia Pacific Working Group, Ms. Erin Tanner, who is an education specialist currently working at the UNICEF Regional Office for East Asia and the Pacific. Over to you, Erin, for the opening remarks, please.
Thank you so much. Thank you so much, Kat. And thank you, a big thank you to UNESCO and to Leonard Cheshire for putting together this important side event. It's really important that we be sure to include children with disabilities in our discussions this week as part of the APREMC conference. And as we know, and as we've known for decades, children with disabilities have the same rights to education as every child in this region. And that's declared in the Declaration of the Rights of the Child. It's also the UN CRPD makes that very clear. And now the SDG 4 is very clear that all children have the right to quality learning. And so if we're going to accelerate our efforts to achieve the SDGs, and if we're going to recover learning for all children in this region, we really need to accelerate our efforts to better include children with disabilities in learning. And in this region, a recent mapping of inclusive education done by UNICEF in the region shows us that children with disabilities continue to be one of the most systematically excluded groups of children in the region from education. So in some countries, less than 10% of children with disabilities are able to attend primary school. And that's a big concern for our discussions this week about learning recovery. In addition, when children with disabilities access education, when they are enrolled in school, oftentimes the quality of the education is not what it should be. Teachers are often ill-equipped to meaningfully include children with disabilities in their classes. Segregated models of education continue to be the norm in many countries. And specialized services to help children with specific impairments are often rare in mainstream schools in many countries. And of course, COVID-19 and the school closures that it brought with it was especially detrimental to children with disabilities who were already struggling so much to learn prior to the pandemic. And during the school closures, of course, many remote learning systems were very difficult to access for children with disabilities. And moreover, children who were dependent on specialized services often were unable to access them during school closures. And of course, like all children with disabilities were at greater risk for experiencing and witnessing violence during school closures. And so now this discussion today is really even more critical. And as we've said earlier, including children with disabilities is our mandate, but it's not only our mandate as countries and as partners, but it's also an important way to advance down the pathway toward quality education. Because efforts to include children with disabilities in education actually benefit the quality for all children of learning. And as we know, disability is a very complex concept, and it's a dynamic one that changes depending on context. And so our data is actually relatively scarce to help us to understand the exact situation of children in education. So these kinds of conversations that we're about to have today are more important than ever, because at the country level, data is quite limited when it comes to looking at how children with disabilities are accessing learning, and even administrative data about how many children with disabilities are in schools and receiving services is limited. And data on learning outcomes among children with disabilities is extremely limited. Although we'll hear about some initial analyses today from UNICEF's mixed survey. And so I think this discussion we're having today to share the research that is available in the region and to hear about some country level experiences is really important, and that I hope all of us, as we engage in the other events this week around the APREMC conference, that we continue to advocate for the needs of children with disabilities in the broader education reform discussions. So I think I'll leave it there, Kat, and I'll hand it back to you for the next piece. Thank you so much.
Okay, thank you so much, Erin, for setting the scene for this side event. As you said, this is a very critical time to discuss this issue in order for us to build back better and more equal. So for now, I would like to invite the moderator of the panel discussion, Mr. Praveen Kumar Gurunath. He's the lead advisor on social inclusion at VSO. Praveen has worked extensively on social inclusion over the past 2 decades. So over to you, Praveen, to introduce and facilitate the panel discussion and the Q&A. Praveen, you're on mute.
Yeah,
Okay.
Can you hear me now?
Yes.
Yeah, thank you very much, Kat, and welcome everyone. Good morning, good afternoon. And Erin has just set the tone for the discussions. And just also want to highlight that over 240 million children with disabilities are there, according to the UNICEF report, which Erin also kind of touched upon. And a recent BBC report also quoted that 30% of children will not be able to go back to school after the pandemic. So let's keep the pandemic also in the context. Yeah. So we have eminent speakers today to talk about experiences and share some best practice. So first we have Ms. Chan Samnang. I hope I'm pronouncing it right. Apologies if I don't get the pronunciation. Deputy Chief Office from the Special Education Department, Ministry of Education and Sports, Cambodia. She has a master's degree in speech pathology from Flinders University, and she has been involved in special education, both inclusive and multilingual education, for more than a decade. She's also been a lecturer, special education teacher, trainer, translator, and a novelist. So over to you, ma'am, and we'll give 10 minutes for each of the speakers, and then we'll move on to the next speaker. So I'll come in and warn you when it's come 9 minutes into your speech. Thank you. Ms. Samnang?
Good afternoon. Can you hear me okay?
Yes, we can hear you.
Great. Thank you. Thank you for the introduction. And once again, a very good afternoon from Cambodia. It is my great pleasure here to share with you all the strategic. I'm sorry. Is the slide presentation is ready now?
Yeah.
No.
Hello, we can't hear you.
Can you hear me all right?
Yes, now we can hear you. Please go on.
All right. Before we start, I'd like to double check about PowerPoint slide.
We're having some technical issues on this side. Would it be possible for you to share from your side?
I can try working on that. Okay. Oh, Give me a second on this. All right. Can you see the slide okay?
Yes, thank you.
Great. All right. So as mentioned just earlier, I would like to share with you all the Cambodian strategy which we use to support children with learning disabilities and children in the indigenous community during the and after the COVID-19 pandemic. In these presentations, I'm going to focus on two main points. The first one is the introduction, which will be briefly introduced, talking about the inclusive education. And the second point is about the strategy that we use to support inclusive education. To begin with, I would like to share with you the statistic of children with disability that enroll in school in the academic year. This number includes the children with learning disability nationwide and also the 6 special education high school. Next is the statistic for the indigenous ethnic minority children in the 5 provinces. As you may know, that the pandemic has impacts almost all the corners of in the world, and it also impact Cambodia in terms of education. We closed the school intermittently since March 2020, and we reopened nationwide November 1st November last year. In terms of policy, Cambodia has a range of law, action plan, and guidelines to support children with learning disabilities and also indigenous in education. We have the law from the Constitution, and also education law and disabilities law, and also some guideline that I'm gonna talk a little bit more detail in the next slide. Now, I'm going to focus on the strategies that we use during the pandemic, and mainly in this slide, we're gonna answer to the question, what did we do during that? There's 3 points in this one. The first one is the inclusive education. In this area, we have produced inclusive learning material, including paper-based and digital material, and then we provide it directly to the children who are in need, in a special need. We also, in terms of sign language, we also integrate the sign language into online, into video, and to support children with deaf and blind to learn. In terms of supply, we have provide a supply and also the device to support, for example, like smart TV to support children who learn from the distance learning. We keep going. We also provide teacher training. We did it online with the Institute of Special Education. We will still work cooperatively with partnership in order to support to produce material like videos to support parents and caregiver to have their children learning at home. Before we reopen the school nationwide, we also provide hygiene and sanitation supplies to prepare for the safety when the children go back to school. So we still wearing masks in the enclosed environment now. And once again, ministry have issued many guidelines to support in terms of distance learning and home-based and small group learning, and in order to make sure that they are safety, healthy during the pandemic. Next is going to talk. Next is about the multilingual education. In terms of this, in order to support children in the indigenous group, we produce a video-based program to the children in the 5 provinces with 3 languages. And we also have episode, a radio episode where they listen and they learn. They also have a worksheet to do as a part of their homework. That was done with both free and primary multilingual education program. And we also provide learning pack for all the students, all the students, and the learning pack where they have reading, exercise, and the material that can support them during the closure of the school. And we work cooperatively with NGOs, namely UNICEF, to deliver the learning pack, the learning session to children in those communities as well. Next is the remedial learning program. We adapt the remedial program from the Ministry of from the Primary Education, and then to support children with special needs like deaf and blind during that. And this program is still carry on until now, which link to the next stuff that we plan to do, which means the activity that we do after the pandemic. So we still keep up with the digital literacy learning resource, training the teachers in order that they can keep working, researching, producing teaching and learning material. We also catch up with the lesson loss, implement the adaptation of the remedial program that I have just mentioned. So we carry on doing this program in order to support the children with special needs. The provision of supply is still going on. So we will be providing and have been providing the audio visual equipments, and also the power to supply to the remote school that do not have the stable electric power. And we also provide easy reading printed materials to support them learning in terms of reading. We also plan to do train teacher capacity building in inclusive education, both in pre-services and in services. And last but not least is we continue doing the preventive measure, and we have wearing masks and hand hygiene for even though the school has been returned to normal, and we don't have any new cases in the last couple of weeks in our country. That's all from my presentation. Thank you very much for listening.
Thank you very much for sticking to time, and very interesting facts coming out there, and how we need to focus on the learning materials, like as you mentioned, the learning packs and the remedial learning resources, particularly for blind children and deaf children. But also at the same time, you emphasized on the importance of building capacity of the teachers and the people who are engaged. So yeah, thank you very much. So without spending much time, we'll move on to the next speaker. So I'll invite Mr. Akihiro Fushimi, who is the education specialist, UNICEF East Asia and the Pacific Regional Office. He holds a doctorate in the field of education, specializing in school self-evaluation, decentralization of education. Over the past 2 decades, he has contributed to educational development in Asia, Africa, and Europe, technical expertise in areas of education sector analysis, planning, education, monitoring, evaluation, specifically looking at the SDGs. So over to you, Mr. Fushimi.
Thank you very much. Can you hear me all right?
Yes.
Thank you. So thank you for the opportunity. And today I'd like to share some of the data which indeed confirm our fear or our knowledge about children with disabilities or the functional difficulties who are left furthest behind in our efforts to education for all, learning for all. As Erin mentioned, my colleague Erin mentioned, that there's a scarcity of data. And this is one of the contributions from UNICEF to fill such a knowledge gap in our understanding of the challenges that children with disabilities and functional difficulties face. Actually, this lack of data means or shows us it's a very clear sign of negligence or less attention being paid to those children, or the issues not prioritized in our education policy and strategies. So I'm very happy to share this data and some of our analysis today. But I just wanted to have just wanted to flag that this is a pre-COVID or pre-pandemic data mostly, although some of them have been collected during the initial stages of the pandemic. So as Chairperson said, that we need to really carefully monitor the school reopening stages and return of those children with disabilities to school and to learning programs, and how they are learning or their learning levels are, and how we can help them further to catch up and to remediate and to address the learning crisis. So let me start the presentation, please. Next slide. So data comes from something called Multiple Indicator Cluster Survey, round 6, which UNICEF has supported the government around the world in the past few years to collect household survey data in education, in health, in nutrition, in child protection, and so many other areas of life in the children. And we are producing now the report, going to finalize it soon and to share with all of you soon about specifically about education and learning of children with disabilities in the 11 countries and 2 territories in the broader Asia Pacific region. We wanted to really prepare this one quickly so that we can contribute to the policy discussions in the ministerial conference, which starts on Sunday, so that the important issues around children with disabilities are to be prioritized. Next slide, please. So based on the social model of disability, the Washington Group and UNICEF have developed something called Child Functioning Module, which contains a set of questions we ask in each household, the parents and their guardians, about the functional difficulties or the difficulties their children face on a day-to-day basis, to put in a rate of no difficulty or some difficulty, a lot of difficulty, or cannot do this function at all. And disability is a result, basically, of these functional difficulties meeting the unaccommodating environment or lack of support. So for example, if a child has a myopia, and then if the glasses or any support has not been given to them, then there's a problem with seeing that has a tremendous implications for their learning and development. So this is not the personal problem of a child anymore. This is the problem or failure of us as duty bearers, as those who are responsible to provide support to all those children and learners. Next slide, please. So in the mix, we have a set of questions in the functional domains for children under 5 and children aged 5 to 17, including those seeing, hearing, and communication, and fine motor skills, and something about the anxiety and so on and so forth. So you can see this in the slide, and you can check it in the report in details. What are the areas of functional domains, and how we are asking the questions about these areas. Next slide. I have quite a few slides about that, so I'm going a little bit faster. Just the context, the Asia Pacific region we are in has the largest number of children with disabilities. So that's really the biggest problem, I think, or the biggest challenge we have to overcome in the coming years. Next slide, please. So first slide is about this children between 2 and 4 years old, and 1 in 20 children of that age group, or 5%, has at least one functional difficulty. And here we have the largest, there's a variation or a variety across the different functional domains, but the most apparent one or the dominant one is challenges in the controlling behavior. Next slide, please. So the household survey of those countries found that, again, confirmed, again, the children with any or multiple functional difficulties are less likely to attend early childhood education. You can see the difference, a vast gap between those with no functional difficulties and those with multiple functional difficulties. Particularly those with the challenges or difficulties in fine motor skills, only 3% of them have attended early childhood education, which is the key opportunity for them to develop, to build the foundation for their future learning and future development. So this is the window of opportunity which has been missed for the vast majority of children. So that's one of the key points we have to remember. So early learning and early identification and detection of the functional difficulties or disabilities. Next one, please. Yes, so children with any functional difficulties, again, we confirm that they have much lower ability and competencies to do a basic numeracy and literacy related tasks. So you can see again, some of the figures that are staggering, particularly for those children with fine motor skills problem and challenges. Only 4% of them can do basic tasks compared to the close to 30% of children with no functional difficulties. So we do have a challenge of access to learning opportunities and development status or other standards of the early age children. So next slide, please. Now we have 5 to 17 years old, so mostly primary and lower secondary and upper secondary age children. Across those 11 countries and 2 territories, on the weighted average, we have 30% of children do have functional difficulties. And here we have, again, those with controlled behavior is the largest group. Next one.
Mr. Fushimi, maybe another 2 minutes, if you can wind
okay,
up.
So
yeah, sure.
let me then a little bit more quicker. So again, we see the same tendency of not attending to school across the children with disabilities. Next one. And here we looked at the gender differences and residential differences, urban and rural areas, and poorest and then richest children. So again, we do see the challenge of the children with disabilities, but those between poorest and richest quintile or the households are the largest across the board. So this is really important to look at the targeting of where we should invest more. Next one. Here you can only look at the red one. Red one means they are not in school, they are out of school children. Again, we see the vast majority of the children who are not in school are among those with multiple functional difficulties. Next one. And then, as Erin said, again, we are confirming that among those out of school children, it's not those who go to school and drop out eventually, but children with disabilities do not have any chance to attend school from the day one. so they never step into the classroom in their life. So that's another challenge to have initial access to education. Next one, please. Like the early age children, so we do see the evidence, very strong evidence among children with disabilities having challenges in mastering the basic and foundational literacy and numeracy skills. Please, next one. It's a numeracy. And next one, please. Just quickly wrapping up. So our reflection is that indeed every country in the vast Asia Pacific region has on its own a unique education system. And there are different stages towards the truly inclusive education and learning systems. And it's important to look at the overarching conceptual framework of inclusive education as a key principle, while at the same time, we need to look at the different needs, different challenges faced by different children with different types of functional difficulties. And we need to tailor our support to meet those demands that are very, very diverse. Next one, quickly key recommendations. You can see it in the report itself, which will come out soon. But one of the key recommendations is that we need to look at holistically the education system approach. It's not only about how we provide the policies, but going beyond the policies, look at the capacity of teachers and schools, also looking at the data issues, looking at multi-sector, multi-stakeholder approach to bring different resources together to tackle those diverse challenges we face in providing support to the children with disabilities. And as I said, early identification is a key. And the next one, the national data system. If you are interested in the data on the children with disabilities, please come to one of the thematic sessions on Sunday, 2 to 4 p.m., which I'm going to moderate. Issues about data for SDG 4, which again, of course, we will touch upon the children with disability again, because that's one of the weakest links or the areas of the data systems in education on SDG 4. And then, again,
Mr. Fushimi, we have to.
Yes, this is the last 2 points, sorry, just 10 seconds. We need to, again, support the teachers and to get the support from DPOs to support the inclusive pedagogies and the assessment systems that, again, are more flexible and more tailored. And finally, the budgeting. The finance is a key investment. We need to look at the investment to support the system-wide inclusive education approach, while at the same time, we need to be very specific in terms of targeting the budget, where to support, how to support, and for whom to support. So on that note, thank you very much for the opportunity, and I'll put it back to the chairperson. Thanks.
Thank you for the excellent presentation. And one thing which really drives home is the use of the Washington group of questions and how effective it is in terms of identifying the needs of children with disabilities, and then how you also highlighted the importance of data management, but also looking at how it is integrated and how capturing the essence of the numeracy and literacy is very important. So these are some of the good practices. So thank you very much. Next, I'll invite Dr. Mark Karu, Principal Researcher, Leonard, Cheshire. Dr. Karu has over 10 years of experience in progressive senior research positions across both academic and NGO-based posts. He has been named on the Disability Power 100 list of UK's most influential disabled people for his work in disability inclusive development. Mark is a disabled person himself and speaks regularly at national and international events on disability inclusion. Over to you, Dr. Karu.
Thank you very much. Good afternoon, everyone, and good morning from the UK. Thanks for having me. So today I'll be presenting research on looking at what teachers need to deliver comprehensive sexuality education in the Asia Pacific region, and we're very grateful to the funding and support from UNESCO for this project. So the time slot I have is short, so I'll be giving a snapshot of the findings and selected areas of investigation. Next slide, please. So in looking at via the research at what teachers need to deliver disability inclusive CSE, we looked at a number of areas which include assessing the comprehensiveness of teacher training resources, looking at teachers' experiences of disability inclusive, providing disability inclusive CSE in the classroom, and teachers' perceptions of their role and the wider support that they need. And just a quick word on why this is important. It's important because people with disabilities have the same rights as all others, and that includes the right to equitable sexual health and quality sexual education. And comprehensive sexuality education, CSE, is crucial to achieve this, yet youth with disabilities are often excluded from CSE and sex education more broadly globally, for example, due to inaccessible environments or negative attitude. So this research aims to contribute to addressing this issue. Next slide, please. So in terms of our methodology, we looked at key global and regional research literature. So for example, your peer-reviewed scientific articles, and we also mapped key global, regional, and the teacher training resources in 3 focal countries as well: Mongolia, Nepal, and the Philippines. So the mapping was done both at the Asia Pacific regional level and in depth in Mongolia, Nepal, and the Philippines. And we supported this also by primary data collection, so via a quantitative survey with teachers across the Asia Pacific region, some key informer interviews, for example, with policymakers, and then we had a deep dive into those focal countries, Mongolia, Nepal, and the Philippines, again interviewing key informants like policymakers or teachers, but also getting the perspectives of parents and students with disabilities as well. And so I'm going to share with you some of the findings. Next slide, please. So the first finding I'd like to share is the lack of comprehensiveness of regional teacher training resources. We found that there's few teacher training resources covering disability and CSE comprehensively in the region, and that where these exist, resources need to be better aligned to international technical guidance, and that there's missed opportunities to join up the guidance with other in-country resources. Now, what do I mean by this? I'll show an example in a moment, but I just want to caveat that these searches were at regional level were limited to English language only, so that it could be one driver of the findings, because we missed the pool that was not in English. But at the focal country level in Mongolia, Philippines, and Nepal, we did do searches in the national language, and our findings were mirrored there as well. Next slide, please. So this is an example of guidance from Fiji. So in Fiji, sexuality education is known as family life education, and this is the family life education teacher's guide shown on this slide. And in this guidance, there's recognition of disability as a risk factor for bullying, but it's not dealt with fully via a rights-based approach. So there's an example of some guidance to teachers to convey to students who experience bullying, and that is never be ashamed of an illness or disability. The sooner you feel okay with it, other people will too. And we would highlight by the research, there's a missed opportunity to spotlight here and capacitate teachers in the socio-structural drivers of bullying. So for example, there is a section on gender equality and preventing abuse and violence within schools, but disability is not joined up and mentioned in that section. And furthermore, the teachers using the family life education guidance are not directed to existing inclusive education guidance issued by the MOE to support their work, which is a missed opportunity. Next slide, please. And then to share an example of where we would say that disability and other identities are effectively mainstreamed is the relationships and sexuality education guidance from New Zealand. So here the guidance starts by grounding sexuality provision in the context of New Zealand's human rights commitments, for example, the Convention on the Rights of the Child, and statements at the outset of the guidance note that sex education is for all learners, and several marginalized identities are included in this statement, including that of disability. And most crucially, also the guidance links and directs teachers to New Zealand's inclusive education resources, which are themselves very robust. Next slide, please. To show you a second cluster of research findings. So most teachers in our regional survey reported that delivering CSE to learners with disabilities was challenging and difficult, but generally teachers felt better prepared and had more experience teaching CSE to learners with physical impairments relative to other impairment groups that we measured. And this was aligned to the Washington group short set via which other impairment groups we measured. So it was visual, hearing, communication, psychosocial. So they were the comparator group. So we also found that teachers viewed CSE provision in general to learners with non-physical impairments as less important relevant to those with physical impairments. So we, via the research, we are calling for impairment-specific support and sensitization for teachers, especially for learner in reference to learners with non-physical disabilities. Next slide, please. And then to speak then about a third cluster of research findings, and that is that teachers need wider support beyond the school, particularly parental engagement. So teachers broadly recognize the importance of disability in inclusive CSE, but they need that support beyond the school. For example, because they recognize that disabled youth, like all other youth, are seeking sexual health information outside of school, and this is particularly a sensitive issue during the time of remote learning, when teachers may have been delivering lessons in the vicinity of parents. So the quotes on this slide are an example of the frequent suggestions of teachers that parents should receive some training on CSE, and teacher perceptions that, for example, from Nepal, that parents generally show conservative attitudes towards CSE provision and the learning of their child. Next slide.
Dr. Karu, 1 minute.
Thank you. Yeah. So note that there may be an urgent need for this information, intervention, and the CSE training of parents, because it is impacting teacher provision and indeed their well-being. So in this quote, CSE teacher shares, "One incident happened to me while conducting an online class. While I was teaching online, one of the parents spoke a very negative, vulgar words to me that made me upset, and I understood that these topics are unacceptable." Next slide, final slide. So our key selected recommendations, there are more. This is a snapshot. So the first is develop regional level teacher training guidance on disability inclusive CSE and scale up promising resources in the region, and that's including linking existing CSE resources to existing national policies and guidance. Second, prioritize the development of targeted classroom aids and resources to deliver CSE to learners with disabilities, particularly non-physical disabilities, and we include in that sensitization for teachers as well on this point. And the third and final recommendation I'm showing, extend CSE training and sensitization to the wider community, particularly parents and caregivers of learners with disabilities to increase their support for CSE. Thank you very much.
Thank you, Dr. Karu, and also highlighting the importance of taking a holistic approach to inclusive education, and also bringing in the fact that importance of gender equality and safeguarding, and also the aspect of how sexual education and orientation is important as well for learners with disabilities. Now let's move on to the last speaker. I'll invite Dr. Hyasum Maria Chang, Director of Office of Public Relations at the Korea Education Research Institute, one of the leading national think tanks in Korea, established in 1972. She has worked as Director of Center for Digital Education Research and Research Fellow at the International Cooperation Division of KIRI. And Dr. Chang also holds a Doctorate of Education from the University of Texas in Austin. Over to you, Doctor.
Hello, everyone. I'm Maria Chang from KIRI, South Korea. Thank you so much for sharing the great the presentation previously. I might think that all the studies was at the Asian Pacific level, and the target was the students with a disability. But relatively, mine is a quite small study, which is from the national level, and then students with health impairments. Okay, can we go to the next slide? Okay, next, please. One more time, please. Okay, good. Well, in Korea, the students with health impairments was under the target of the special education from 2005 with a Promotion Act of for special education. The definition of the students with health impairments are the students who needs continuous medical support, such as long-term hospitalization or outpatient treatment for more than 3 months. So I might think more than 70% of the students with health impairments are with a cancer, such as blood cancer, such as like leukemia, and 20% of them are with rare diseases. Well, we learned the RMS for the students with health impairments from 2016 with the Ministry of Education Korea, which we call School for You. This is for the elementary and the secondary level. The research question for this study was how to promote students' learning engagement. As you all know, during the COVID-19, most of the students, they couldn't go to the school, and then they had to do all the online education. And then most of the students with health impairments, they cannot really concentrate on the learning without their teachers and then peer students. And all the education gap was promoted as Karu's presentation already confirmed that there was a big gap between the different aspects of the students. That's why we focus on how we can promote students' learning engagement in the learning management system. Next slide, please. Okay, again. The issue that we want to focus on was learning engagement, because most of the students, they lose their interest in their learning because they have to just stay in their houses, and then no peer students, and then they don't really have lots of interaction with their teachers. That's why we focus on the learning engagement, how to promote the learning engagement and promote their scores and then their attendance status. But most of the studies, they were focused on the higher education level. So that's why we focus on the elementary and then secondary level with the students with health impairments, and also in the online learning environments. From the study we conducted in 2020, we found out the psychological motivation, peer collaboration, cognitive problem solving, interaction with instructors, learning management, use of LMS are important indicators of students with health impairments learning engagement in online learning environments. But these studies were based on the data from the survey. That's why last year we tried to just collect the data all from the LMS and try to conduct more empirical studies. Okay, next slide, please. So methodology, next one. Okay, the methodology, what we used, okay, it goes, yeah, can we go back one more, please? One more, yes, good, yeah, well. Next slide, please. Thank you. Okay, we conducted the statistics based on the R version 3.6.3. We conducted the t-test, correlation, and then OLS. We collected all the data from the 807 students from the first 10 weeks of the year 2021 from the 16 school districts. Okay, next slide, please. Okay, from here, we can just focus on the explanation of all the variables, I think. You can just see the V1, the school level. The group number 1 was focused on the elementary number 1 to number 3. And then group 2 was elementary 4 to 6. Group 3 was a middle school students, the grade number 1, 2, 3, and then group 4 was a high school students, all high school students. And please just check the V13. We just focus on the learning outcomes, which is a combination of the attendance rate plus average of the formative assessment. Okay, can we go to the next slide? Next, please. Okay, you can just see the whole descriptive statistics in this slide, and let's go to the next. Okay, from this slide, you can see some of the there is only one minus at the first row, because this student's background, which is a school level, correlate with V13, which is learning outcome, was minus, which means is elementary school students, they focus or they just concentrate on their online learning better than the high school students without any treatments. But goes up, the grade goes up, like relatively the high school students, they need more treatments from the teachers to focus on their online classes. And you can see some of the scaffolding data and the diverse courses data and the real-time and the non-real-time data. All the students who use the real-time plus non-real-time lessons, their scores and then attendance rate were higher than the others. Okay, can we go to the next slide? Okay, so I just focus on the minus at the top, and then the others, or there are significant, statistically significant at the 1% significance level. Okay, can we go to the next slide?
Dr. Chang, 2 minutes.
Okay, this is my almost my last slide. Okay, this is the research from my overall statistics. Can we go to the next slide? And we can see the highlights. Okay, so when you see the model 6, we can focus on the model 6 because as you see, the adjusted R squares with of the model 6 are the highest, right? So we can see the model 6 first. With the school level, concentration level, and then checking learning history, that makes the students like more focus on their online education. Like elementary school students, they more focus on the online lessons, like a relatively more than the high school students. And the concentrate level, or the when they check their learning history or their patterns of their learning process, their scores or the attendance rate were higher than the others. And participating the diverse courses, if they participate more than the others, like more than 4 lessons at the same time, then they could more focus on the others than on their studies. Okay, and as I mentioned before, some of the students who were in the real-time lesson and the on-real-time lesson at the same time, they could focus on their lessons more than the others. Okay. Right. Okay, thank you so much for listening to my presentation. Thank you.
Thank you very much, and thanks for sharing the interesting study and some of the findings which is coming out of that. So very helpful. So now we'll open the floor for question and answers. And Catherine, if you can help me out if there are any messages in the chat box, or people can feel free to raise your hand or unmute and speak.
Okay, we have a couple of questions in the Q&A box. So the first question, the data on young children with functional difficulties highlights the importance of preparing early childhood teachers and workers on disability inclusive practices. What do the Asian Pacific countries do to address this?
Yeah, so any of the panelists want to take this? Hello.
Sorry. Yes.
Yeah.
This is Aki from UNICEF April. I am not the expert on early childhood development or the inclusive education as such, so I'm sure that some of us in the panel have better kind of examples, but I have learned from my colleagues that, for example, in the Philippines, there is a specific program, very successful, called prevention, early identification, referral, and intervention of delays, disorders, and disabilities in early childhood. This is a very long name of the program, but I think that has been a very successful, quite comprehensive program in the Philippines. I think it was in the Mindanao for the inclusion of children with disabilities that has a specific components around of course, teacher training, service delivery, and so on. I think that's one of the good examples I have learned in the Asia Pacific region. Another one I learned was about Mongolia, who whose government has a very clear focus on the teacher training and service delivery in an inclusive way across the kindergartens to cater for children with disabilities and without functional difficulties, both of them together. Over. Thank you.
Thank you, Mr. Fushima. Next question, Catherine.
The other question is, what kind of assistive device that was provided to children with disabilities during COVID-19?
Yeah, Ms. Samnang, I think you mentioned about the assistive devices. So any experiences you want to share?
Yeah, I did. Thank you very much for the questions. The assistive devices are the abacus and slats, and we also have braille paper, and we have the wise cones, and that also softwares application that for the translation is a braille language translator and transcriptions. We also have way recorders and playing materials for learning, for example, like puzzles, pictures card, and also reading glasses to support children who have vision impairments. Thank you.
Thank you very much. Next question, Catherine.
I think that is all. Oh, no, we have another question. So are there policies and programs in the Asian Pacific countries that integrate learning support specialists and allied health professionals in the public school system to increase partnerships for inclusive education?
Who wants to take this? I think it's a wider question. So Mr. Fushimi or Ms. Chang, I mean, I think you touched upon these points. Yeah, so anyone, yeah, please go on.
Yeah, just one point again, what I know about is that we talked about the importance of data and the importance of identification of the children's disabilities and functional difficulties. And when we have done a review of the education management information systems, particularly those systems that track individual students. It's not only about schools or classroom level information, but individual students and their health status, their academic status, their family status, their socioeconomic status, and so on, which we have done particularly with a country like Mongolia or Timor-Leste and Malaysia. And some of the countries do have a partnership, special partnership between the Ministry of Education and Ministry of Health to work together, particularly around those identification and follow-up processes. And also, Ministry of Education data teams are trying to link those different administrative data systems so that, that they can find the challenges in the health sector and the health records together with the individual students, so that they can see the risk of children be at risk of dropping out or making the transition to the next level of education and so on and so forth. So that's I see in some of the countries. Thank you.
Thank you. Dr. Chang, do you want to add anything or?
Well, for the second question, yeah, I want to add one thing. That with the COVID-19, almost the students with health impairments, they had a limited physical education. That's why from this year, we just offer the HMD, the head-mounted device. And then from the metaverse environment, we had a tennis or the table tennis or the bowling games. That's why all the students in the very safety space, they could join on the physical education. Yeah, thank you.
Thank you very much. Any other questions or anyone wants to ask a question, you can raise your hand and
Yes, so there are no more questions in the Q&A box, but if any participants would like to ask any questions, please feel free. No questions.
Okay, so any final comments from the panelists? Any last thoughts you want to share in 1 minute?
I can give a couple of thoughts on the questions that have come up. Although I've just lost the question window. Okay, it's back. So yeah, I just wanted a reflection on the question of what kind of assistive device was provided to children with disabilities during COVID-19. I mean, I think as I mentioned, our research showed that one of the issues is that for remote learning, the platforms are far more less accessible to learners with disabilities. But I think the last example I showed on slide 9 was an example of how even when these platforms are available and accessible, then the vicinity and the attitudes of parents may then influence the degree that children with disabilities can access those devices, even if that they are at face value accessible. And then reflecting on the third question around policies and programs to integrate learning support specialists and allied health professionals in the school system. We as a further finding from the CSE research that didn't have time to include, we did find and would suggest that it's valuable to provide CSE training, disability inclusive CSE training to these broader network of health professionals, for example, school guidance counselors, so that they really can provide support specifically to learners with disabilities in a comprehensive and inclusive manner. Thank you.
Thank you very much, Dr. Karu, for that interventions. So just before we conclude the panel discussion, key points that come up is definitely we need to look at how holistic interventions we do make. There's importance of assistive devices, importance of disaggregated data, importance of identifying learners with disabilities, but also working at the systemic level in terms of building capacity of teachers and some of the researchers' presentations which were made by the panelists that highlight the need to look at, for example, having the, what different approaches we take to ensure learners with disabilities have access to education. Yeah, I'll just kind of highlight 2 data points, I think, which we also need to keep as important is the World Health Organization reports that only 5 to 15% of people who need assistive devices actually receive them. So you see there's a huge gap. And also the World Blind Union did a study and say that only 1% of the resources are really accessible for blind people and deaf-blind people. So it's very startling, these facts and the context that we are in. And of course, many of you did mention the pandemic, and we are just coming out of the pandemic. And there are a lot of challenges which UNICEF studies have also reported that children, going back to school is a huge challenge. And we can imagine the situation of children with disabilities. So a lot of work to be done. And thanks to UNESCO for organizing this particular panel and very good, sharing of best practices, which have been put at the forefront over the last 40 minutes. So thank you, and over to you, Catherine.
Okay, thank you so much, Praveen, for your excellent facilitation of the session and also of the discussions as well. So as Praveen just mentioned, it's been very interesting to hear about the importance of data, of course, in terms of accessing educational needs of children with disabilities, in order for us to develop mechanisms to provide learning support to them. And it was very interesting also to hear from Cambodia and Korea's experiences, and also, of course, the importance of professional development of teachers. So next on the agenda, so let me take this opportunity to introduce you to Ms. Sunanda Mavilapalli to provide some closing remarks for this side event. So Sunanda is the Global Head of Programs and Technical Assistance at Leonard, Cheshire. So over to you, please, Sunanda. Sunanda, you're on mute. Still cannot hear you. Can the host help to unmute? No, we can't hear you.
Sorry, she's on mute, but we can't hear you, Sunanda. You're not on mute, Sunanda, but we can't hear you.
Maybe do you have like headphones or something that might help? No. So it's not working? No. Okay, so I don't think this is going to work. Is she is she trying to unmute?
No, I think she still has issues, Kat.
Okay. Okay, so maybe Barka, would you like to say a few words to close the meeting on behalf of Sunanda?
Sure, but apologies, I won't be able to switch on my video because it's going to conflict with my, the captioning. But anyways, thank you very much. So I'm just stepping in quite suddenly for Sunanda, and from the presentations we did hear that in Asia Pacific region, we all know learners with disabilities are among the most excluded from education, and they're facing serious barriers such as inaccessible school facilities. We also heard there was a lack of assistive technologies, classroom and teaching and learning practices that are not inclusive. And on top of that, it's of poor health, and there is prejudice and discrimination. And from this, we hear that learners with disabilities are less likely than their peers without disabilities to attend primary school, and 1 out of 2 children with disabilities are out of school in the region. So despite of these challenges, there is still very good efforts to ensure that learners with disabilities return to school, and that the education system is more inclusive, it's more flexible and equitable. And we could hear from the brilliant examples and presentations from the government of Cambodia, the Korean Educational Development Institute, KD, colleagues from UNICEF, East Asia, and Leonard, Cheshire. And as we continue, to charter a new territory in the wake of the pandemic, many learnings have certainly emerged. The COVID-19 crisis clearly presents a unique opportunity for us to not only rethink the need for accessible and inclusive education, but also to steer in the direction that the hour demands. And therefore, I think the Asia Pacific Education Ministers Conference second comes in at a very relevant time, as most of the countries in the region has started to reopen schools. It is highly important, as we all know, that learners with disabilities should not be left behind to return to school, as we know that the governments and educational institutes are gradually setting up learning recovery measures. So the Disability Inclusive Working Group in Asia Pacific and the co-chairs, UNESCO, UNICEF, and Leonard, Cheshire, we're very pleased to have organized this side event today. And we would particularly want to thank the organizers of the APREMC and the participants today who've made time to attend this session, and to all the speakers, panel speakers, the moderators for your valuable contribution at the panel session. Thank you very much, and we look forward to seeing you again in another session and in some of the APRC meetings in the next couple of days. Thank you very much.
Okay, thank you so much, Barka. So very inspiring words towards achieving the 2030 target. So for your information, maybe some participants are also attending the session. So on the 5th, which is the first day of the second Asia Pacific Regional Education Ministers Conference, we have the panel session on equity, inclusion, and gender equality. So we will discuss and examine more on the situation and the progress of the country's commitments to ensure inclusive and equitable quality education. And also we'll be including the most disadvantaged and vulnerable learners as well, which includes children with disabilities. And also the discussion will lead to an agreement on relevant policy areas of action. So looking forward to you joining us with, for other sessions in this important conference. And thank you again for the fruitful discussions today, and we hope to, which hopes to provide a good basis for further discussions around the issues of disability, inclusive education in the future. So thank you. Bye.